Hi, I'm Hillary Cohen, the Chief of the Emergency Department here at Englewood Health. I'm right now here in our resuscitation bay in our emergency department, where just a few short months ago, the halls and the rooms were filled with patients with COVID-19. Today, I'm really happy to say that there are patients here getting their regular emergency care. In our emergency department today, there's not one patient with COVID-19. How did we get here today from those difficult days in the spring? Well, we got here not because of a vaccine, not because of a great medical breakthrough. We got here today because of our community and what our community did to keep safe. But today, it's more important than ever. We cannot become complacent. We cannot let our foot off the gas. If we want our children to be able to go back to school this fall, if we want to celebrate holidays like Halloween and celebrate Thanksgiving with our families, and most importantly, if we want to make sure we can control this virus and not let it control us, we know the simple things that we need to do to prevent the transmission of COVID. So I've asked a few of our medical experts today to talk to you about what these things are that we know prevent the transmission of COVID and how we are going to keep ourselves, our families, and our communities safe this fall.
My name is Ashwin Jathavedam. I'm the Chief of Infectious Disease here at Englewood Health. Today I'm going to talk to you a little bit about masks and the importance of wearing masks to prevent spread of COVID-19. So COVID-19 is mainly spread through what we call respiratory droplets, so sneezing, coughing, which can infect people in the immediate vicinity. Wearing masks helps both prevent the spread from someone that's sick and also prevents someone that's not sick from contracting it. But to be effective, the masks have to be worn properly. We do suggest for the public, cloth masks usually tend to be best tolerated. You can get reusable masks these days quite readily. I suggest getting at least a 2-ply mask for better protection. So in terms of wearing the mask, first you want to ensure that your hands are washed or sanitized. You want to handle the mask by the outer strings. Put the mask over the bridge of your nose. Loop the strings over your ears. You want to make sure there's a good seal and fit over the bridge of your nose, and then gently retract the bottom to cover your mouth and chin. Okay, so to remove the mask, you want to gently handle the strings. Try to handle only the outside of the mask. Ideally fold, and you would put into your container or bag, and then wash your hands or sanitize immediately afterwards. If we all can adhere to the masking that the government and the CDCs are advising, we can really limit the spread of this and literally save lives.
Hi, my name is Lauren DeLuca. I'm a neonatologist here at Englewood Health. The most important thing you can do to help stop the spread of COVID-19 is to stay home if you're sick. If you have any symptoms or have been exposed to COVID, stay home, stay away from others, and call your doctor. Symptoms of COVID-19 can range from mild to moderate to severe illness. Common symptoms include cough, fever, shortness of breath, but you can also have more mild symptoms like cold-like symptoms, nasal congestion, sore throat, runny nose, or headache. Stay alert and trust your instincts. Stay home if you or your child have any symptoms of COVID and call your doctor immediately.
Hand washing is one of the best ways to protect yourself and your family from the spread of bacteria and viruses. By washing your hands, you can prevent yourself and others from becoming sick. Here are 5 steps to wash your hands the right way. First, wet your hands under running water, warm or cold, it doesn't matter. Then lather with soap and scrub for 20 seconds or sing the happy birthday song twice. Don't forget between your fingers, the backs of your hands, your thumbs, and your wrists. Then rinse well. Dry your hands using a clean towel.
When you enter a crowd, you always have to be aware of the situation. It involves a number of factors that you yourself have to judge and be cognizant of. Those factors include the environment itself, the number of people, and whether people are observing social distancing practices. So in regards to the environment itself, it's important to realize and recognize whether it's an indoor versus outdoor environment. Certainly, an outdoor environment has more open air. Air does not become trapped within a certain confined space versus an inside environment where people are more at risk because there's less airflow. Virus particles can be trapped and circulate throughout the air more freely and within the area that the people are within. The second thing we always have to worry about is the crowd size. So if you're in a crowd that involves a handful of people, that is certainly much safer than being in a crowd involving dozens of people. You should always use your judgment, certainly be aware of your surroundings to keep yourself safe.
And one final reminder, please get your flu shot. It's safe, it's effective, and it saves lives.